There are additional labs, but some of them are often done: complete blood count, comprehensive chemistry, which is kidney, liver function, thyroid. Often primary cares do these. The other ones we often do is mycoplasma pneumonia, which is walking pneumonia. CDC sent out a warning last fall. It was so bad in the grade schools they felt they needed to tell us, which because it's not normally there. Mononucleosis, which is also called EBV virus, Epstein-Barr, herpes, and tick-borne illnesses, Lyme, Bartonella, etc. And then I do much more immunoglobulins, that's the IgG, plus a number of other parts of the immune system. ESR, CRP are inflammatory markers. ANA is an antibody about the brain that's elevated a lot in any kind of rheumatologics, lupus, scleroderma, any kind of those illnesses. Ferritin and iron, etc., are being checked. And I check a lot of nutrients as well, going forward with all the other, and I look for a number of other viral infections. So this is from the PANS consortium called the PANDA's PPANS. Anyway, in 2017, they got together and made this graph and said, this is what we should do. This is the treatment model. It's three-pronged. It all needs to be considered. The first one is treating the symptoms with psychiatric medications, psychotherapies, and supportive interventions. I'll comment on that in a minute. Remove the source of inflammation with antimicrobials, meaning antibiotics, and then treating disturbances of the immune system with immunomodulatory or anti-inflammatory therapies. That's often a step up from just giving them. Treatment one, treating the symptoms, traditional. So behavioral and psych need to be managed alongside the illness. In fact, one of the traps parents get into is they want, now that they know it's medical or they suspect it's medical, they don't really want to deal in the psychiatric world. They don't want to be labeled. It's stigmatized. I fully know that. But in fact, without sometimes a psychiatric medication, you can't control the psychiatric symptoms while the inflammation is being treated. But some are not so severe. Some will actually, if you catch it early, a dose of antibiotics and some NSAIDs like Advil or Aleve, and take care of it, and you don't see that child again. But many times, because it's hard to get to people like me, it's often misdiagnosed. You're often in the psychiatric world before you even consider the fact that they have PANDAS. Now you're deep in the psychopharmacology without a diagnosis. But it usually needs both if it's moderate to severe PANS symptoms. However, treating PANS symptoms with psychiatric meds is usually not the same as normal because they're very sensitive to very tiny doses. So if you give a Prozac dose of 10, which is maybe a 10-year-old's beginning dose, or you give somebody 25, that dose to begin with for like a week, and then you go to 20, which is an average beginning dose for depression. If you even approach 20 for many of these kids, you make them crazy. They get angry, irritable, manic, suicidal. It's not good. So everything, even if you're dealing with a psychiatrist, which I'm hoping some of you can, besides people like me, you have to coach them to do it small. And this is in the PPANS directory, which I reference below. And so, but also the other thing is therapy. Although up here, they tell you to go to therapy. Well, if your child's mild and they can work on OCD and consider their anxiety, it works. But if they're really inflamed, they cannot take in therapy. Therapy requires that you have a thought process. You can remember things. You can organize the thought in your head. So when the therapist suggests you do something, you might actually be able to do it. So it's an overstatement in all of our thoughts who work with this, that to say therapy and a little bit of Zoloft will do the trick. Start there. If your child's totally debilitated at home, no longer able to go to school, can't dress, can't do their sports, lost out on basketball season, can't go out with their friends for a jaunt to the stores, you're not going to get anywhere with just therapy and a slight amount of serotonin measurement like Prozac. The treatment often more ends up with hospitalization with severe food restrictions, which weight loss requires hospitalization to keep them from becoming medically impaired, psychosis, aggression, severe tics. And psych units are ill-equipped to handle medical treatments, and med-surg units are not equipped to handle psych issues. Ideally, a parent would be allowed to stay with his child, and if you're on a medical unit, that's allowed. But if you go to psych, you're left on the outside and the door is locked between the two of you. So it's extremely important to use hospitalizations and emergency rooms if it's a threat to life and safety of someone, either you or your child. Because if you're talking about an older person, they sometimes pull out a knife. They're not sure who they're going to stab, but their brain is telling them they got to stab something. You have to take hospitalization seriously as a way to prevent harm, but ideally, you don't get hospitalized. You try and work very hard to avoid it, but you don't avoid it to the risk of safety. It's a hard decision. I appreciate it, but that is a bottom line. But as a result of a child who can't separate from somebody's kneecap like their mother, and then you put them in a psych unit, it's trauma beyond belief, trauma for the parent, as well as trauma for the child. And also hospitalization is also denied by clinicians. They just go, yeah, they have to be hospitalized. They don't understand the parent and the child's relationship at that point, that they're so severe. You know, the child's so severely needy of you. That is not traditional separation anxiety people, that you would be hospitalized because you have separation issues. And their separation issues have to do with their OCD and the rules that they have in their head and how you play into them. Removing the source of inflammation. Sometimes it's time, antibiotics and tincture of time. Many people come to me with having had an OCD event 2 or 3 years before in a young child. It kind of came and it went. That's because if there's no other inflammation, no other illness, no other strep, those antibodies that I mentioned that cause the problem do slowly decline in your body over a couple months. And then the solution is that you don't have a problem. But if it's serious enough, you need to move on to bigger things. The first is antibiotics. You'll hear Augmentin, Keflex, and Zithromax as most. And then we try about a month of those antibiotics and see if it moves the needle. Also, NSAIDs. I know this is online everywhere, but I do tell people if they talk to me and they're still not my patients, I say, I can't officially tell you this, but if you do a standard dose of your children, according to normal directions for Advil, which is naproxen, or Aleve, which is Motrin and ibuprofen, you can see if you can move the needle and bring the behaviors down a notch. And there's a lasting remission from antibiotics. Now, why? So antibiotics are not there particularly to treat strep. It's often gone by the time you see the patient. And you're only seeing the antibody action. This is an illness of antibody misdirection, not the illness itself. So why antibiotics? This is what confuses a lot of medical people. They get very upset that we are giving repeat antibiotics. It's because antibiotics are anti-inflammatory. This is an NIH article published. So if you need to show this to somebody, here's your reference. And we try to discontinue them if there's no flares, no further symptoms. And we also use a lot of probiotics to counter the possibility of getting gut disruption, especially Candida yeast in your gut when you're using chronic antibiotics. And then you might move towards a short dose of prednisones, which is anti-inflammatory, one step up on the treatment model. And then antihistamines are given a lot for behavior because they're calming, they're sedating. Guanfacine and clonidine are tic medications along with ADHD medications. Occasionally, somebody like me might use lorazepam or Ativan or something like that to bring anxiety down because, again, if I'm trying to keep somebody out of the hospital, I'm going to use as much as I can, including these meds, to lower the temperature of the anxiety and the aggression. I mentioned a lot about SSRIs, so I'll go on about that. Antipsychotics, yes, unfortunately, they're used. Many kids cannot tolerate SSRIs or any other antidepressant, so you have to use one step further. Even though they're antipsychotics, the chemistry of all antipsychotics is about dopamine and serotonin, the very two things that you're seeing represented in tic issues and in serotonin issues, which are Prozac, Zoloft, Lexapro, etc. Stimulants are rarely helpful, and this is a danger because you get diagnosed with ADHD by a person who says, well, your child's hyperactive and they're inattentive and they can't study and they can't go to school. So they have ADHD, let's put them on a stimulant. Well, they agitate more than anything. Non-stimulants at low doses can be useful. You go low and slow when you start these meds. So, okay. Cognitive supports I've mentioned, some of them are called CBT and ERP, which is exposure response therapy, which is the traditional therapy for OCD. There's a lot of supplements here, a few that are listed. Dietary, inflammatory, gluten-free, dairy-free, sugar-free, coloring dyes. But let me just be frank about this. If your child's barely eating, you're not going to take the only thing away from them that they're eating, which happens to be gluten and dairy. That would be a way to go to the hospital really quick. So although a lot of practitioners promote this, and I'm all for it, I feel like there's a reality about when one can actually carry that out and the age of the child and their cooperation, because the last thing you need is a child who will not eat because you're not giving them anything they can eat or they will eat, especially if their brain, remember I said they crave sugar and carbs. Parents need a lot of support. Thank goodness there's Facebook and a lot of parents PAN support groups out there. This is immunomodulator therapy, which is higher up on the list. This is where longer steroids are used, IVIG, which I'm not going into detail, but basically IVIG is IgG. Remember, I mentioned that's the antibody that floats around in your blood. They take thousands of people's blood and take out this little thing called IgG, and they give it to you. And that IgG carries all sorts of antibodies. So COVID and flu and norovirus, the antibodies to those are given in such a huge dose, it shakes up the immune system. Think of a snow globe and you're shaking it and all the snow settles back differently than it was before. That's what IVIG does to the abnormal IgG activity. Tonsillectomy, I won't go into. It can be helpful if you have a lot of strep issues. And then very rarely is rituximab, which is a drug actually used for rheumatoid arthritis and other autoimmune disorders, but also plasmapheresis exchange, which used to be available here, rarely ever here. Dr. Latimer is probably one of the few people, and there's a doctor now. No, Dr. Latimer used to do it, pardon me. And there's a doctor now in California that one of my patients just went out to see who did plasmapheresis on her, because there's no one here that believes PANS requires that. It is still available in all major medical centers, but PANS people aren't allowed to. So the other process and the most painful part probably of having this illness is what we call flares. Your child's getting better. Then they have, a recent one was they have a boy come over, spent the day with them inside. The boy's brother had strep. The boy actually probably was a strep carrier because every time he comes over and spends time with his child indoors, the child goes crazy within the next 3 days. If they're playing outside on bikes, never happened. Some people are carriers. Sometimes we check all members of the family to see if they're carriers, by the way. In early treatment, they're much more vulnerable to these relapses because the immune system, even in early treatment, is very vulnerable. It's still on hyper antibody alert. So any illness that I have or you have, anybody in the family has a little bit of a cough. That little cough means there's an activity of some viral thing going on. And you're putting that antibody, and the child picks it up, their antibodies go, whoa, we got to get going. We got to get really up there and really protect this person. And the antibodies get activated, which is bothering the basal ganglia, and now you're back down to a lot of symptoms. This happens a lot with pneumonia. I see kids have repeat out flares when they develop cold sores because that's a source for them. COVID's created a lot, I mentioned. And also very importantly, in PANDAS, although not really recognized by the formal PANS physician network or the major medical centers, is that if you have a major tick disorder, underlying chronic tick-borne illness, and mold, and folks, if you live in New England, the chances of having one or both of those are very high. We live in a very wet environment here. I mean, we're not in Louisiana where water tables are super high, but there's a lot of granite outcroppings, and there's a lot of water in basements, and there's a lot of ice dam flooding and roof leaks. And you also have a lot of ticks everywhere. Now, ticks are really pretty endemic all over the United States, but in the New England area, it's really bad. And you can have a tick bite, of course, and never know it because the bullseye is a fallacy that it shows up all the time. It's maybe less than 50%. Ticks are often sesame seed size. They can drop off and you'll never know you. So why consider infection for a neuropsychiatric problem? I'm not going to touch on all this because I'm getting behind on time. But basically, the Spanish flu, I want to point out, is a SARS virus. And it showed all these medical issues, all these kind of psychiatric issues after it happened, 20%. COVID is exactly the same. About 20% of people after COVID develop psychiatric disorders. Bartonella is a common tick-borne illness. It causes rage, anxiety, and some strange-looking stretch marks that shouldn't be on a child with stretch marks. Sometime we can talk more about that.